All right, good morning, everybody. This is Matthew Garnice from Bizmatics Marketing. Thank you for attending this webinar titled The Credentialing Do's and Don'ts, or the Do's and Don'ts of Credentialing. And it's going to be a discussion of sort of your process in dealing with insurance companies to become an in-network provider. So let me get forward with the introductions. So we have the executive team, the credentialing executive team. With the head of the team is Dawn Isco, and we also have Stephanie Gaston and Brittany Morales to talk about best practices in credentialing. So I'm going to pass the screen over to Brittany, and we'll get started.
Thanks, Matt. So the first thing I wanted to talk about was what exactly is credentialing. So credentialing is the process of insurance networks. They go through and check several documents, they do a background screening, and they basically check to make sure that the provider meets the standards set out by the insurance company. So in that process, they're going to check several different things: the medical license, malpractice, DEA, any schooling information, as well as a data bank search. Credentialing is also done on an individual basis, so it's done by person to person per provider, and it's also done by state. So what is done in California might not or will not transfer over to a different state. Credentialing is only good for the state that it's been completed in. There's also two different types of credentialing. You have the first type, which is called delegated credentialing, and delegated is where a large hospital or a large practice, typically 250 plus providers or so, credential the providers themselves. And so they go through the verification process in-house, as opposed to direct credentialing, where the insurance company does the credentialing themselves. So you send off the information to United Healthcare, the insurance company in general, and they do credentialing directly through them. So the next question that we often get is, who do you want to credential with? So we know that there's a vast network of different insurance companies that you can be in with, and sometimes that's hard for providers to narrow down, okay, I want to be in with these networks. So a couple of things that we recommend to do is first to check your competitors. So if there's a provider that's doing the same exact thing that you are, and they're maybe 10 or 15 minutes away from you, check and see what they're on. That's a good place to start. The next place to look at is your local hospitals. That specifically any that you're in with, so if you have active privileges at a hospital. But a hospital is good to look at because it will encompass pretty much everything that's in the area. So it's a good place to find a database, if you will, of what potentially you could see. The other area to look at is anything that you would get referrals from. So if you're a specialist and you have a PCP that you're good friends with or that would refer to you, find out what they're in so that they can refer a patient over to you and you can see them. One of the things that is not listed here but is a good resource as well is to look at some of your large companies. So things like Disney World or theme parks or large factories, a university, see what network they're in with. And if you're within a good distance from them, that's going to be the network that you want to focus on and get in, put the most effort into getting in with so that you can see all of their employees. The next question we get is, how long does it take? And this is not a quick process. It does take some time, but I wanted to go over some of the types of providers that will take the longest. So anybody that's fresh out of school, so they are just completing a residency or they're just completing an internship or anything of that nature, they've never done any kind of primary practice credentialing. The other is if you're moving from one state to another. So I mentioned earlier, California's credentialing is not good for Oregon or Kentucky or wherever. So if you've never practiced in a state, you're going to have to go through the process all over again. The next thing is if you're switching from what we talked about, delegated credentialing, over to direct credentialing, that's going to also take the longest amount of time. And so just to kind of reiterate, delegated, the insurance company gave the process over to the large clinic or the hospital in most cases. So the hospital had to do this background screening to give you privileges and to allow you to practice in the hospital. So the insurance company says, okay, great, that meets our standards, so there's no need in us doing it for all of your 200, 300, 400 providers directly, so we'll just take that as good. So when that's terminated off because you've moved from a hospital, the insurance company now has no active credentialing on you because somebody else maintained it. So that's where you're having to go to what we call direct credentialing, where the insurance payer is now going to have to credential you directly. So first, I'm going to go over some of the do's, and then Stephanie will go over some of the don'ts. So the first do is obviously you want to start early. Some time frames can take anywhere from 3 to 6 months. Some payers are going to take anywhere from 8 to 9 months. It just depends on the payer and your location. One thing that we do notice a lot of is this time of year, so August, September, the back to school time, as well as the beginning of the year. Everybody wants to open a practice, and so what happens is everybody calls the insurance company and they start submitting applications. And so things that normally take maybe 2 or 3 months to complete will start to take the full 3 months, or they'll take longer, anywhere from 4 to 5 months. So you want to be aware of the time frame. In general, Blue Cross Blue Shield and Aetna are, as well as any of your Medicare and Medicaid MCOs, are typically going to take the longest as well. That's regardless of the time of year. It's just their process and the time frames for them. But there's some states like Texas that are even longer. So in Texas, they have this unique thing where you cannot enroll with Medicaid until you're enrolled with Medicare. So you start the enrollment for Medicare, that takes 3 months, and then after that 3 months, you start the enrollment for Medicaid, that takes another 3 months. So you're now 6 months into the process. And then let's say that you want to get on with an MCO, Amerigroup, WellCare, something like that. Only after you've enrolled with both of those products can you start the process for Amerigroup and Staywell. And that process, you have to be credentialed all over again with them. So that can take anywhere from another additional 3 to 6 months. So in total, you're looking at anywhere from 6 to 12 months to get onto that final MCO. So the next thing that you want to make sure is that you maintain all of your documents. The first one, the most important one, is the CAQH. Make sure that that's updated, that's current, everything is correct in there. You also want to make sure that the DEA and your license and malpractice are good. A lot of times what insurance companies will do is if your DEA is scheduled to expire within a couple of weeks and you will be going through the credentialing process, the insurance company will say, okay, let's hold on until this is updated and then we'll resume our process. So if you're within a couple of weeks, months time frame of one of your documents expiring, you need to make sure that you're at least starting the process. That way you can tell the insurance company, hey, I'll have everything by date X, and then you can send everything back in. We see this as an issue with malpractice a lot because malpractice expires every year. So your DEA and license, it doesn't tend to happen that frequently with. The other thing that you want to make sure is that your CV is current. So a lot of times providers, they forget to add on their CV, their current and their new practice, and they think, well, I'm not seeing patients here yet. But what I always tell them is it's still a business. You still started the process to created a business, and so it needs to go on to your CV. And also for the insurance company, it's a good point of reference. They are going to see, okay, this is where they're currently practicing at, and then they can also just go chronologically from there of where you, what your past history was, checking all of those as well. So I wanted to talk a little bit about what a CAQH is. Some of you might know, but it stands for the Council for Affordable Quality Healthcare. And essentially it's a database that providers can log into, and they can put in all of their information, anything that you can think of this ask. And then insurance companies can easily log in and access and retrieve all of that information. So it's a centralized location for providers to put things in and insurances to easily access it. Now, just because you've enrolled with CAQH does not mean that you've started any of the credentialing process. Most payers do not, actually none of them, you have to let them know that you want to start the credentialing process. And so most of the time you have to make a phone call, fill out a short application, a page or two, and let them know, hey, you know, I've got a CAQH, here's my identification information, here's some my date of birth so you can match it. The other thing is some payers, some of your smaller payers, they are not going to necessarily use this the way that larger payers do. So your larger payers, Aetna, United Healthcare, they will go in and access your CAQH like we talked about previously. But your smaller payers, they won't have access to it. But that doesn't necessarily mean that you can't utilize it. There's actually a function on here that allows you to go in and print out a standardized form, and you can sign off on a couple of pages and send it in to the insurance company. Most of your insurance payers will accept that because it's a standardized form. It's got all of the information that you need, and it's easy for them to retrieve that information. So do number 3 is that you want to know your state regulations. Sometimes because you're okay to practice in a certain state, you meet all the requirements, doesn't necessarily mean that you're going to meet all of the requirements for credentialing. So that's something you need to check on. And you also need to know that things vary by state. So we have a lot of providers that move from one practice or one state to another, and sometimes they get into a little bit of a pickle because they don't realize that, okay, I didn't need this in California, but I do need it for credentialing purposes for another state. So I thought we would go through some of those examples, and the main one is a nurse practitioner and a supervising physician. A lot of states don't require that a nurse practitioner have a supervising physician. They can just go in and practice and they're good to go. However, almost all of our networks with all of the different states do require that a nurse practitioner have a supervising physician that is also in network. So the other example is a hospital privileges. We have a lot of providers that just because of their scope of practice, they don't ever need to admit patients, and so they don't have hospital privileges themselves. It's tedious, that kind of thing. So what the insurance company requires is that the provider have either hospital privileges themselves, or they can have admitting arrangements from a provider that if something were to happen, that provider could easily admit a patient for them. And the main thing that we find is it's not just you have to have a supervising physician or you have to have somebody to admit for you. Those providers also need to be credentialed. So they don't necessarily need to be listed on your contracts and as a physician on your practice and all of that, but they do need to have already gone through the screening process with the insurance company, the credentialing process with the insurance company, so that the insurance company knows that they're fine and, you know, they meet all of their standards and regulations. So do number 4 is there are some fees that are associated with this process. The main ones are going to be Medicare and Medicaid. I tell any of our mid-levels, nurse practitioners, anything that's not a physician, an MD or a DO, you can expect to see at least a fee here and there. DMERC is one that will require a fee. That's typically somewhere around $560. Some Medicare Medicare enrollments require a fee as well. We have some smaller Medicaids that are $100, things of that nature. And then if you are credentialing for, say, a surgery center or a facility, those prices will go up. Medicaid enrollments can go up to $500 or $700 just for the surgery center enrollment. So just be prepared for some of those fees as well. So I'm going to pass it over to Stephanie, and she's going to go through the don'ts.
Thanks, Brittany. The don'ts, as with credentialing, we have the do's, but we also have the don'ts. The don'ts tend to be tedious work that we have to go back over and constantly review and double check with the insurance carriers. CAQH is an excellent tool that I often refer providers to because it keeps providers aligned with their expiration dates on their licenses, the malpractices. It also allows providers to maintain their updated information as far as their mailing address, their pay to address, and CAQH also has another uh, portion where it allows providers to set up their EFT for the direct deposits. Now, whenever a provider needs to do a name change, an address change, tax ID, uh, update their MPI information or anything, we always have to notify the insurance carriers. And one thing about it, providers don't often update their information until after the fact. So I always refer providers first to your maintain your update with your MPI registry because some providers may have moved an address from an address that they haven't practiced in 3 years. And then when the insurance carriers tend to process their claims, they look at that information and they also notice that he or she has not updated their MPI number. I had one doctor who was a referring doctor, and every time we filed her claims, we always wondered why her claims were being denied or rejected or reprocessed by another entity. Well, one day I just happened to go to MPI registry website and I found she was still listed as in Illinois. Even though she had moved from Illinois over 2 years ago, the insurance company referred to her MPI information. So I requested that that physician go back, update her MPI information with the correct address, the contact information. Then we had to go back and request all of her claims to be processed. So lack of updates affects the revenue, which is the money that comes into the practice. If insurance companies receive our information, we don't just take for granted that everything's going to be okay. We have to constantly call. We have to constantly call to make sure that the insurance company received it. Then we have to follow up to make sure that they have processed the information correctly and that they are clear in what our requests are, because we have to understand they're human beings as well and they sometimes make mistakes, but we have to make sure that they follow through on the with the requests that we made. We always request reference numbers when we contact insurance carriers and document the name. So if there's a problem and we have to go back to someone, then we know we can reference that person who we spoke with on whatever date we spoke with that person along with their reference number. I also had a provider one time that we were doing a name change, not a name change, I'm sorry, an address change. And the doctor's first name was Danny, but there happened to be another doctor within the same state whose name was Daniel, and they had the last name. So the insurance company, instead of picking up the phone and calling or double checking the information, they just eliminated our provider, Danny, because they thought that was the other provider's nickname, and they roll that information over to the other provider. And to my understanding, some of it's been straightened out, but it's been almost a year, and we're still having to go back and forth with the insurance company trying to get it straight. It resulted in claims processing incorrectly, patients having claims processed out of network because our doctor that sent the claims in, the insurance company did not have that place of service address and that doctor's information. So it's always important that we continue to follow up because sometimes faxes end up rerouted to the wrong area or sometimes we may even misdial, is sending out a fax. So it's always best to keep everything on a timeline to make sure that you're staying up to date on what needs to be done. Don't number 2, don't wait till the last minute. CAQH, I always suggest to providers, if you're not going to reattest monthly, and when I say reattest, that's go into your CAQH login, make sure all of your information is still the same, and then click on the reattest button. That allows the insurance companies to go in and see the last time that you updated your information. So if a provider is not doing that every month, I often recommend that that provider does it every 60 days. But CAQH will send the provider and your credentialing contact person an email letting them know, hey, it's time for you to reattest. We either need this information updated, this is about to expire, we need an updated W-9, or we need your controlled substance license or whatever they may need. So when CAQH sends you the update, sends you the request letting you know it's time to update, and you log in and you go into the system, if anything is delinquent or deficient, it's going to be lit up in red on the last screen. So that allows the provider and the credentialing department to know that, hey, this is something we really need to get on top of. Once we update that information and upload it into CAQH and the doctor signs off or attests their application, then we contact the insurance companies to make sure and advise them it's been updated. So whatever information they need, they can pull from it. This is also another time when you're looking at your license renewals. Never wait till the last minute to renew your license or you renew your your malpractice. Just because something expires at the end of the month, don't wait 3 days before the end of the month, because the turnaround period from your insurance provider may not be as quickly. So then by the time the insurance company reviews your information, if we don't have your updated information, then it's going to show expired. Then your credentialing will come to a halt until the insurance company receives that updated information. I always advise people, if you're updating your information through your insurance companies, always document the day you faxed it or the day you submitted it, because oftentimes you're going to have to resubmit that information more than one time. Don't number 3, don't assume you are in network with certain products. I always suggest to providers, you have to know your product, you have to know what you're signing up for, and if you're unsure of it, I always recommend to providers, try to get on as much as you can. For example, I had a nurse practitioner who assumed that because she's on Medicare and Medicaid, that she would be able to see United Healthcare Community Health Plan patients, which is a Medicaid product. The problem with that is she's not credentialed with United Healthcare, and she was very upset and said, I'm a Medicare provider and a Medicaid. I don't understand. So I had to explain to her, United Healthcare owns that product. But in order for you to see patients, yes, you have to have a Medicare number and a Medicaid number. However, you have to be credentialed with United Healthcare. And the United Healthcare plan within her state is closed. They're not accepting any new providers at this time. So what I did recommend to her, contact the carrier and see if they will give you authorizations for those visits of those patients that you treated, which may happen or it may not happen. But it's always best to know what plans you're on. That's why I always recommend to offices, as soon as a provider is credentialed, email or give that communication out to your staff. Advise your staff members of the effective date of their providers and their plan type, whether they're on the PPO, whether they're on the HMO, if they're just on the PAR plan, or if they're on the open access, or just whatever. But you just never take for granted that just because you're credentialed with one entity, that it's going to cross over into the other entity. Don't number 4, Revalidation and recredentialing is very important. Failure to do so can stop your money from coming in. And as quickly as your money is cut off, unfortunately, to get it back to rolling does not happen in a rapid manner. For instance, Medicare publishes the information on their website, advising payers, advising providers who's up for revalidation. Also, the commercial insurance payers, they tend to send out letters in the mail. And oftentimes, doctors, if it's not a check, they won't open that mail because they know if their checks go direct deposit, it's automatically going into their bank account. So if there's someone in your practice that is well versed in the credentialing process or the revalidation process, or you receive some information that you don't understand, I always recommend to people that you forward that information over to someone who can assist you because, if you're depending on X amount of thousands of dollars to come in per week, then all of a sudden that stop, then you're going to run into problems as to paying your rent for your practice or making payroll or other responsibilities. So I always tell people, instead of trying to keep up with everything in your head, either get a big wall calendar, write it down, or put it in Outlook, or try another different software that's out there that would allow you to put future dates in there. And instead of putting the final date on the calendar, I would put 90 days before it's set to happen, because that way it allows you enough time to get all your information together, to make sure all of the information is current. If you have a new doctor that has come into the practice, it allows you enough time to get with that doctor and say, hey, this is what I need, and this is why I need this. So as soon as you get this to me, we can go ahead and start.
Bear with us one moment. It looks like we have technical difficulty with
It's
the
not letting me,
slides.
it's not letting me go to the next slide. There it goes.
Okay.
Okay, so
Okay,
at this point, you're probably a little overwhelmed, but Bizmatics can help. We have a bunch of different services for credentialing services. So if you are adding a new provider, if you're brand new yourself, opening a new clinic, if you're changing your location, if you're doing some sort of demographic update, we also have a yearly maintenance package that goes over and handles some of the stuff that Stephanie was talking about that you don't want to forget, updating your CAQH, tracking and letting you know when different documents are set to expire, things of that nature. So I think that is it. If anybody's got any questions, we can go through.
Thank you, Brittany and Stephanie. I do have a few questions already for you, so I'm going to go ahead and ask them. The first one would be, how should a provider decide whether they should join an EPO or PPO?
I always suggest to providers you have to become familiar with your patient base, whether you're seeing a majority of HMO patients, a majority of PPO or EPO. But EPO, since that's more specialized network, I always recommend to specialists and primary care physicians to get on EPOs and PPOs, because if a primary care physician is treating a patient on their product and they need to refer the patient to you, it's always best to be on the same plan. So I always suggest to providers it's best to be on as much as out there.
Wonderful. The second question that came in, what are my options if a panel is closed?
So if a panel is closed, you have a couple of different options. The first one is just to call every couple of months. The insurance company will typically tell you 3 to 6 months. You can call on a monthly basis. That's a little bit more difficult to get into. The best option is to have your patients, if you have a couple of patients, say with United Healthcare, that you can't get into the panel because the panels are closed, but patients are coming in and telling you you're the only person that's got an open panel and seeing patients, you know, I need to be seen, you typically have to get an authorization to see that patient. So what we've done is we have been able to take to the contractor and say, look, you know, this provider is having to have 5 and 6 patients that are coming in, and they're having to have an authorization every single time. And so it shows the insurance company that it's more cost effective for them to just go ahead and credential and contract you, as opposed to tying up the line and getting, you know, approvals every single time. So that's the best bet if a panel is closed.
All right, and my third one is, how often should I make sure that my information with the carriers is correct or current?
I always suggest every 30 to 60 days, because there can be little things as a PO box changing, a suite number, a provider has opened up another practice location, provider may have moved from their home address, or they may have a separate pay to address. So I always recommend every 30 to 60 days.
And as a provider, do you suggest that I seek participation with as many plans as possible? And then what are the key things that I should look for with each plan?
So I think it's best to get in with as many payers as possible, especially if you're a brand new practice, because you want to be able to see as many patients as possible. A lot of providers don't know this or don't realize that if you're in with a network, it's essentially free advertising, because the insurance company is going to list you on their network of providers, so you're seen there. But it also allows you to establish a client base, and then, you know, later on down the line, if you realize, okay, I'm not seeing a lot of insurance X, then you can decide, okay, do I need to renew my contracts? Do I need to re-credential with them? That sort of thing. So in the beginning, unless you're adding a physician and you know what insurance is to be on, it's best to just get in with as many as you can, so that you're not missing patients.
Okay. And then it looks like that's all that's come in so far. If anyone else has a question, there's a little chat box in the right-hand side of the GoToMeeting, and you can type your questions there. Okay. It doesn't look like any more are coming in. So I know Matt will post this webinar up online for everyone to have a copy of. And should you guys have any questions, please feel free to email sales@bizmaticsinc.com.
All right, well, thanks everybody for attending. And as Kristen mentioned, these slides will be up on our website within the next few days. Yeah, we'll also be sending them out to you. And you can check out learnprognosis.com/webinars to see our future webinars. The next one coming up is on August 28th about MACRA. So stay tuned for that. And thank you for attending.